Welcome to this explainer on the 2026 Medicare Roadmap. Today, we're navigating what can honestly feel like a complex, high-stakes labyrinth of Medicare rules. Look, if you're approaching 65 or planning your retirement, you probably already know that Medicare is not just a simple sign-up sheet. Oh no, it is a highly structured system with very specific rules, strict timelines, and financial consequences that can literally last a lifetime. So we're going to break down the latest 2026 reference guide data step by step and map out exactly what you need to know. Let's get into it. So, could a simple Medicare enrollment mistake cost you for the rest of your life? Well, we're tackling this huge question right out of the gate. Because making a wrong turn in the Medicare maze isn't just a temporary headache. It can actually trigger lifelong financial penalties. Understanding the rules before you make a move is absolutely the best way to protect your retirement savings. Trust me, you want to get this right the very first time. Here's our roadmap for today's explainer. We'll cover 1. Coordinating coverage, 2. Avoiding penalties, 3. Transitioning off employer plans, 4. Choosing your path, and 5. Understanding costs. All right, Section 1, Coordinating with existing coverage. Let's figure out who pays first. When it comes to your existing coverage, the magic number you need to remember is 20. If your employer has 20 or more employees, your group health plan pays first, and you can usually safely delay your Medicare Part B. But if you work for a smaller company with fewer than 20 employees, Medicare immediately steps right to the front of the line as the primary payer. In that smaller group scenario, if you don't enroll in Medicare on time, you could be left holding the bag on massive unpaid medical bills. Why? Because your employer's plan simply won't pay a dime until Medicare does. Now, what if you aren't actively employed? If you're relying on retiree coverage, TRICARE, or Medicare, please do not assume you can just skip enrollment. With the rare exception of active military duty, Medicare acts as the primary payer here. If you don't enroll, well, you're practically volunteering to pay out of pocket. You know, a lot of retirees incorrectly assume their old union or company plan covers everything. But the reality is those plans fully expect Medicare to take the lead. Moving on to Section 2, Avoiding Costly Medicare Penalties. We are officially entering the watch-out zone. Let's look first at Medicare Part B. Think of this as your medical foundation. It's what covers your everyday outpatient care, your doctor visits, specialist consults, and vital preventative services. Just to be clear, this isn't for your hospital stays. This is the day-to-day coverage you'll likely use on a routine basis to stay healthy and manage any ongoing conditions. Here is where you really need to pay attention. If you delay Part B without having active, creditable employer coverage, like we just discussed with that 20-employee rule, you trigger a massive 10% annual penalty for every single year you delayed. And here's the absolute kicker. That penalty is not just a one-time slap on the wrist. Nope. It is tacked on to your monthly premium for the rest of your life. Just imagine paying a permanent 10, 20, or even 30% surcharge on your healthcare costs just because of a simple paperwork delay. Next up in the penalty zone is Medicare Part D. This is your prescription drug coverage. Whether you buy it as a standalone plan to complement original Medicare, or you get it bundled inside an Advantage plan, it doesn't matter. Either way, you absolutely need drug coverage. Now, the math on this one is what catches people completely off guard. Delaying your Part D enrollment results in a 1% penalty per month. That's calculated against the national base premium, which for 2026 is $38.99. I mean, 1% a month? That equals 12% a year. It adds up incredibly fast. Let 5 years slip by without creditable drug coverage, and you are staring down a 60% penalty. And just like Part B, this penalty lasts as long as you have Medicare drug coverage. No escaping it. All right, Section 3, Transitioning Off Employer Plans. Let's navigate your timing windows. So if you're aging into Medicare, you get a 7-month initial enrollment period. Let's use Bob as our example to simplify what can be an incredibly confusing window. Bob turns 65 on June 18th. His 7-month enrollment window doesn't just suddenly happen in June. It actually opens a full 3 months prior, in March, includes his birth month of June, and then firmly closes 3 months after at the end of September. Missing this specific window without having other credible coverage? Yeah, that's exactly what triggers those lifetime penalties we just talked about. Okay, I need to emphatically highlight this warning right now, because it is literally one of the most devastating traps retirees fall into. Medicare does not consider COBRA to be creditable coverage. I repeat, relying on COBRA instead of enrolling in Part B during your specific window will instantly trigger those lifetime penalties. COBRA coverage actually ends once you enroll in Medicare anyway, though you might occasionally be able to keep certain non-Medicare benefits like dental. The bottom line here, do not rely on COBRA as a substitute for Medicare. Just don't do it. When you do finally leave active employment, you get to deal with everyone's favorite thing: paperwork. You must submit Form CMS L564 to Social Security to officially prove you had creditable group coverage. Doing this excuses you from the penalties and grants you a special guaranteed issue right. But listen, the clock is ticking. You generally have a strict 63-day window from the exact day your group coverage ends to secure your new Medicare plans. That brings us to Section 4, choosing your Medicare path, original versus advantage. You essentially have two main routes here, and it really comes down to freedom versus convenience. Original Medicare gives you flexible, nationwide freedom. You can see any doctor or visit any hospital in the U.S. that accepts Medicare, and you don't even need referrals. Medicare Advantage, on the other hand, well, that's the all-in-one convenience route. These are bundled plans from private companies that roll your hospital, medical, and usually your drug coverage into a single plan. Advantage plans often utilize specific networks of doctors and might toss in extra perks, like vision or dental. Now, if you choose the original Freedom route, you're essentially piecing your coverage together. You've got Part A for hospital stays and Part B for medical care. But, and this is a big but, original Medicare only covers about 80% of your costs. And crucially, there is absolutely no out-of-pocket maximum on that remaining 20%. That is exactly why you'll likely want to shop for supplemental Medigap coverage. You really need that extra layer to ensure a major, unexpected surgery doesn't completely wipe out your hard-earned retirement savings. Finally, we hit Section 5, understanding your Medicare costs. We are officially arriving at the toll booth. Let's start with some truly fantastic news. Most of you watching this will pay absolutely $0 for your Part A monthly premium. Zero. As long as you or your spouse have worked and paid Medicare taxes for at least 40 quarters, which translates to roughly 10 years in the workforce, your hospital insurance premium is completely 100% covered. For your Part B medical coverage, though, the numbers do shift. The standard 2026 monthly premium is $202.90. This amount is actually fairly convenient because it's usually automatically deducted directly from your Social Security check every single month. If you aren't drawing Social Security just yet, no worries, you'll simply be billed quarterly for this premium amount. However, your costs might actually be significantly higher. Medicare utilizes a 2-year look back at your modified gross income to determine your actual premiums, which honestly often catches high earners completely by surprise. So if your individual income in 2024 was over $109,000, you're subject to an income-related monthly adjustment amount, what they call ARMIA. Higher income brackets trigger progressively higher Part B premiums, scaling up rapidly. And they also tack on completely separate surcharges to your Part D prescription drug plans, too. We've covered a massive amount of ground in this explainer today, from coordinating with employers to dodging those ruthless lifelong penalties. Please don't wait until the last minute to figure all this out. Check your coverage, map your timeline, and avoid the traps. So the ultimate question I'll leave you with is this: are you prepared to navigate your exact Medicare enrollment window, or will you let a simple paperwork delay dictate your retirement finances forever? Take control of your Medicare journey today.